Welcome back to Financial Clarity for Doctors, everyone. This is Rachelle Vanderzin here with Corey Janoff.
Hello.
Yep. And with open enrollment coming up or ongoing for a lot of you folks, maybe it's right behind you. Maybe you need to come back to this episode next year. But there's lots of decisions to make about what benefits to enroll in, especially if there's been any changes to the insurance offerings at work, or if you've had family changes even, like a different circumstance for you could mean that different insurance options make sense at work too. So how do you decide what's right for you and your family? Today, we're going to focus a little bit on the health insurance aspect of it, because there's a lot of different things that go into making a health insurance policy. What are the different pieces? What changes, like whether or not it makes sense for you? And we'll talk a lot about the financial parts of that. How much are you paying out of pocket? How much are the premiums? All that kind of thing. Because the basic question is, how do we pay the least amount possible for our medical care? Like, we want to maximize every dollar that we have. So obviously we don't want to give them more medicine or more, more of our money than we have to. But there are also some non-financial things to consider as well, which is completely understandable. And that may be the first thing that you think about, So if you do have doctors that you'd like to continue care with, make sure that they're in network for whatever plan you're going to select, because your costs can be a lot higher if you end up having to pay out of network costs. So that's just a couple of things that look at. With some employers, you might just have a couple of options, honestly, like this one or that one, and that's it. And it may be fairly easy to choose. But for some employers, you may have a lot of different options. And if you're buying your own coverage on the open market because you're self-employed or anything like that, obviously there's a lot of things to consider and a lot of different plans to consider. So we're going to start just by talking about the basic structure of some of these plans and then talk about the different pieces that go into it. You want to kick it off, Corey?
Yes. And yeah, it might, if you and your partner both work, you might have, multiple plans through multiple employers to pick from to weigh which one is right for you. And if you have a family, you got that into consideration. And while the objective is to pay as little as possible for healthcare, at the same time, we want to have an insurance plan that's actually going to pay for the care that we need when we need it. So depending on your circumstances, if you have certain ongoing medical conditions that you need treatment for, or you have certain providers that you want to see for various whatever, you want to make sure that that's all going to be covered by your health insurance plan. So really, when you're exploring your plans through work or on the exchange, it could be worth calling them up and inquiring, like, hey, are these doctors in network? Are these types of procedures covered? What does this plan actually cover? Especially if there's like a certain thing you need, like if you're going to be having a child, for example. All right, can I deliver at this hospital? Can I have my provider be the doctor that delivers the baby? If you want to get a certain maybe elective procedure, is it going to be covered by this health insurance plan, or what percentage am I going to be responsible for? So that can help weigh your decision one way or another. In terms of the different types, you guys probably are more familiar with some of this than Rachelle and I, but you've got your high deductible, low deductible plans. Most plans nowadays we see are preferred provider plans, PPO plans, but there's several other variations as well. Like HMO is common, like the Kaiser model, if you will. We're not going to get into Medicare today because that's a whole nother episode in itself. But with pretty much all health plans, preventative care is going to be covered, like your annual wellness exam, child visits as well, which usually you got a little bit more leeway with getting your kids taken care of. And then, your required vaccines like flu shots, etc. Usually those are going to be covered by all plans. With a high deductible plan, the deductible is what you pay before the insurance company steps in and starts paying. So the higher the deductible, the more you have to pay out of your own pocket before the insurance is going to start covering your medical expenses. The lower the deductible, the less costly it's going to be. Now, generally speaking, the higher the deductible, means, you pay more for your healthcare. Therefore, your premiums that you pay for the insurance are going to be lower. Whereas the opposite is true. If you have a lower deductible health plan, the insurance company is stepping in sooner. Therefore, your premiums that you have to pay for the insurance are likely going to be higher. So it's, you get what you pay for. It holds true, in this world. If you're going to pay more for your health insurance, usually you're going to have a few more bells and whistles, or the insurance company is going to start covering costs sooner. If you're going to go with a lower cost policy, you're going to be more responsible for your own out-of-pocket healthcare expenses.
Yep, absolutely. And with a high deductible health plan, you often can also set up what's called a health savings account, or an HSA. If it's HSA eligible. So if it's an HDHP, usually that is a plan where it is HSA eligible. Sometimes the employer will offer it so you can just do it through payroll deductions. Sometimes you have to set it up on your own. And we'll talk a little bit more about HSAs in a second. With the lower deductible plans, you can often do like all of your office visits outside of preventative care, like prescriptions and things like that with a copay, instead of you having to pay like a whole bunch of money until you get to your deductible. So let's say, you have an office visit because you have the flu and it's just not clearing up and you really feel like, okay, maybe this isn't the flu. Maybe we need some antibiotics, whatever. If that's the case, then, maybe you do a $30 copay for your office visit and you have a small copay for your prescription as well. So that's how that works with a lower deductible plan. With the high deductible plan, all of that's on you until you hit your deductible, the prescription cost, the office visit, all of that. So the deductible is a big part of what your insurance is. And we've talked about it a little bit so far already, but just to speak more directly about what that is, it's basically how much you pay out of pocket before the insurance company will cover anything for a high deductible plan. And it can be a pretty big range. It's not like every plan that's a high deductible plan has the same deductible. There are some plan like minimums and maximums that's set by the federal government because of the Affordable Care Act. So in order to qualify as a high deductible plan in 2024, your deductible will have to be at least $1,600 for an individual or $3,200 for a family plan, which is actually not that high. I mean, I don't know, maybe I'm a little jaded and have seen really high insurance costs, but that seems fairly reasonable. We can, have a $3,200 deductible for our entire family and it still qualifies as a high deductible health plan. Often it can be quite a bit higher than that, though, just depending on the insurance that your employer offers you or that you secure on the market. The maximum allowable deductible is $7,500 for an individual and $15,000 for a family plan for any like HCA qualifying, or I'm sorry, not HCA, but Affordable Care Act qualifying plan. So they're not going to let you be on the hook for everything. I think the big push with legislation regarding healthcare costs recently has been to kind of limit how much of those catastrophic costs you could potentially be responsible for. And by lowering like the maximum deductibles and out-of-pocket maximums, that's what they've kind of achieved at this point. Yeah. It's also why healthcare is and insurance is so much more expensive. So, definitely a double-edged sword a little bit.
Yeah. The insurance company pays for more means you got to pay more for the insurance. Yep. Simple relationship there. Absolutely. So you got your deductible. So that's, one of the first things to look at. Then you have your co-payment and your co-insurance payment, two separate things. So the co-payment, like Rachelle mentioned, you might have to pay a $30 copay for your office visit. And in your policy, it'll detail like what the copay is for different types of things. Maybe office visits are $30 copays, or for this type of visit, it's a $50 copay, whatever. But usually it's a, reasonable amount that you got to pay just to get in the door. And then the co-insurance is what percentage of the medical cost you have to pay for and what percentage the insurance company has to pay for. So let's say, the visit to the doctor is, $500 and the prescription that, you're getting is $1,000 and you have a 20% co-insurance. Well, so you pay 20% of that cost in this scenario, ignoring all the other, things that go into it. But let's just forget about the deductible for now, just the co-insurance. So if it's a $1,500 total bill, you would be on the hook for $300. The insurance company would be on the hook for the other $1,200 in that simple example. And then you continue to pay your, after your deductible's been met, you continue to pay your co-insurance until you reach your out-of-pocket maximum. And the out-of-pocket maximum is written into the insurance contract. This is the absolute maximum you will be required to pay out of your own pocket. So you got, major surgery, medical expenses, treatment, etc. You've seen what some of these medical bills are from the hospital. I mean, just if you have to stay overnight in a hospital, it's like a $30,000 expense at least, probably, when you start adding it all up. So that out-of-pocket max somewhat, protects you. And like, here's the most you're going to be responsible for. You have your out-of-pocket max as an individual, and then for the family as a whole for the year. And then it's going to be different for in-network versus out-of-network. So this is where the health insurance companies, it's kind of a big scam in America, how this all works. Because you might go to an in-network hospital, but the treating physician might not be part of that network. Maybe you have the surgeon, the anesthesiologist, whatever, like one of them's part of the network, one of them's not part of the network. You had the ambulance ride there because, you don't know, like you're just needing immediate care. And now you're stuck with a big tab for an out-of-network cost because, like you didn't control who was on staff in the ER that night. But, so there is still some element, that's broken in America's healthcare system, as you all are aware, but that's, again, not for today. But if you are able to decide when and where you're going to seek treatment, you want to make sure you're going ideally to an in-network provider, obviously, so that, the costs are more reasonable. But even with the out-of-network, there's going to be an out-of-pocket maximum that you pay. It's usually double the in-network cost, but it's still capped so that you're limited in your financial exposure there.
Yeah. The one thing is that in a case that is truly an emergency, technically, like they can't charge you more for going out of network, but they may try to argue with you about whether or not it was really an emergency. If your leg is broken and you need surgery, like going to the ER because your leg is broken, yes, emergency. Surgery following that, maybe they're going to say, hey, you could have figured out where to go to have surgery so that you were in network. At that point, it wasn't an emergency. I mean, I don't know that they would make that argument, but there has definitely been situations where you have to argue, yes, this was an emergent situation. This out-of-network cost should not apply in this situation.
Yeah, but hopefully you don't have to be faced with that fight, because we've all heard numerous horror stories of insurance companies denying claims for one reason or the other. Oh, this wasn't a necessary procedure. It was elective. It's like, no, this was necessary. It was, but anyways. And
or
you
guys
had
a good example of planning ahead for that too. You can plan ahead for that sometimes when it's not emergent.
For sure. And you guys see the other side of it too. You have to fight with insurance companies sometimes to get your procedures reimbursed, depending on what the thing is. But yeah, so when it comes to, looking at the in-network versus out-of-network, especially if in advance, hey, I need to have this procedure done, or I'm going to, have this. In our case, when we were having our second child, the health plan that we're on through our company requires us to deliver at one of their hospitals. Now, the hospital that was closest to our house and the one that, Lindsay's, OBGYN worked at or right next door to and could, deliver at, was a different hospital system than the one that our insurance covered. So even though our insurance covers the doctor visits and everything, they say, oh, if you're going to deliver a baby, you have to go to one of our hospitals. And it's well, we don't want to have to drive all the way to the other side of town to go deliver and not have her provider. So we ended up actually, opting out of the the company plan for her. So I just had my individual coverage through work. And then we got a separate policy for her through the health exchange, healthcare.gov, that would allow her to, still see her primary doctor and deliver at the hospital that we wanted to deliver at. And then when she went into labor, we called the hospital, say, hey, we're on our way. They're like, yeah, we're on divert. We don't have enough nurses, so we're at maximum capacity. So you need to go all the way to North Portland to the other one. So it ended up being even further away. But yeah, Randall's Children's Hospital is really nice. They move you over there to that. Or is Randall at OHSU? Or which one's at Emmanuel? I think it's Randall at whatever. The one at Emmanuel in Portland for any of you that are local. Really nice. It was built, I don't know, a handful of years ago or 5-10 years ago. So food's way nicer up there than in Tualatin at Meridian Park. But anyways, so we went through all these hoops so we could deliver at the hospital close to our house, and they were full. So we ended up at a different one anyways.
Well, and that kind of just shows you that you can plan as much as you want. And there will be things that are unplanned that are like outside of your control. So, I mean, in this, we're kind of focusing on the things we can control, but realize like if there's an emergency, like all of this is kind of out the window. It is what it is. But so the one other thing, I mean, there's a couple other things to talk about here, but another big thing is the premium cost itself, like what you are paying. So when we're thinking about all these things, we're going to think about all the different pieces that we're paying for, like our deductibles, our office visits, our prescriptions, like how much we're going to pay on this plan versus this plan, and then compare it to the premiums that we're paying for those plans. So pay attention a little bit to get an accurate estimate. Like if it's biweekly, times it by 26, that's your annual payment. If you're getting paid monthly on your, like maybe you're comparing yours and your partner's plans, like which plans should we use? And, make sure that you're comparing apples to apples, not just like how much it is per pay period. And then keep in mind that if you are a W-2 employee and you have employer provided health insurance, you're probably paying a pretty small portion of what the actual cost of that health insurance is. And it really, like when we're thinking about financial decisions for ourselves, then yes, like it matters just what we're paying out of pocket, right? But if you're thinking about switching jobs, that's one thing to think about is, like how much coverage am I getting? What am I paying? Is my employer paying a large portion of this so that I have decent coverage and I don't have to pay an arm and a leg for it? Because that's often what's happening. Like Corey said earlier, like the high deductible plans usually have a lower premium because the insurance company is there's less of a upfront cost for them if something does happen. And really it's like, why else would you choose a high deductible plan and have less coverage? That's why, because you get to pay less. The other thing is that a part of this, like this, the kind of like second part of this health insurance is also the way that we can pay for medical expenses out of pocket. So a lot of times you have either a health savings account or a flexible spending account for healthcare or both through your employer. And those accounts can be really, really cool if you have expected medical costs. The health savings accounts themselves can only be funded if you have an HSA eligible health insurance plan or like a high deductible health plan. And that's like a government rule. That is not like your employer's rule. That is that the government says you have to have a high deductible health plan in order to be able to use an HSA. And that's because the HSA is super cool. And they're trying to encourage people to use high deductible health plans to kind of lower overall medical costs and medical insurance costs. There's a limit on how much you can contribute per year, but they are pre-tax contributions. So every dollar you put into an HSA or an FSA actually is pre-tax, which means you're not paying income taxes on it. With the HSA, you can potentially invest money. You may have to have like a small portion in cash, but extra you can potentially invest and you get tax deferred growth and also tax-free withdrawals if you're paying for out-of-pocket healthcare costs, which is kind of big. Like you can invest money, let it grow, take it out and use it pre-tax. So it's like the only account where you can invest without paying taxes, let it grow without paying taxes, take it out and use it without paying taxes. Literally the only account that you can do that. Yeah, you go, Corey. I feel like I talked long enough.
Yeah, health savings accounts are pretty awesome. I may not be quite as over the top enthusiastic about them as the internet in general. Like you read about, some blogs about health savings accounts and people are going all out about how fanatic they are about them and how great they are and how to utilize them. And like the hack is you maximize your contributions to them every year, which is it's like I think the limit's like $8,000 next year. Um, but and it adjusts every year with inflation. And then you invest your money, it grows over time. It's going to have its ups and downs like any investment, but hopefully over time it grows. Now, these health savings accounts are designed to allow you to pay for your out-of-pocket health care costs with tax-free dollars. But a lot of the bloggers out there will recommend, oh, save your receipts because you can get reimbursed indefinitely. Let the money compound. And then, when you're 65 and go on Medicare, then submit all your receipts for reimbursement at that point after the account has had 3 decades to compound and grow. And in theory, that sounds wonderful. In practice, I can't imagine anyone hoarding receipts for healthcare costs for 30 years to then and keep track of them without losing them to then try and get reimbursed all at once. And I can only imagine the administrative hurdles of trying to get those reimbursements too. So I recommend, and I might be alone in this, but I recommend people get reimbursed along the way. It's designed to pay for your healthcare costs as they occur with pre-tax dollars. So you have a medical expense, you have money in your HSA, use the money from your HSA to pay for that medical expense. Now, typically the people who use high deductible health plans that are HSA eligible generally don't have a lot of expected healthcare costs. Otherwise, they'd go with a fancier insurance plan that pays for more of their stuff because you're going to be responsible for more of your out-of-pocket expenses with those types of plans. But if you're healthy, your kids are healthy, you never go to the doctor other than for your annual checkup, then yeah, going with the lower cost plan, putting $8,000 a year pre-tax into the HSA can make sense. You're saving money on taxes, investing the money, you have a slush fund available for if and when you do have out-of-pocket medical expenses. And then once you're eligible to go on Medicare at age 65, that HSA kind of converts into a pseudo retirement account as well. You can still use the money in there for out-of-pocket healthcare expenses tax-free, but you can also start withdrawing it for whatever you want. If you withdraw it for non-healthcare expenses, you have to still pay income taxes on the amount you withdraw, just like from your pre-tax retirement accounts. But it's nice that you have that additional flexibility there. Now, last thing, so the HSA is wonderful. Balance carries forward year to year. You can continue to compound and grow that over time. People often confuse them with flexible spending accounts. So there's the health savings account, which is the HSA, and then there's the healthcare flexible spending account, which is the FSA. Now, the flexible spending account also pre-tax contributions can be used to pay for out-of-pocket healthcare costs tax-free. However, the money in a flex spending account does not carry over from one year to the next. I think a few years ago, they changed the rules to allow up to a maximum of $500 can carry forward. So these are use it or lose it plans. If you're enrolling in your flex spending account, you have to be positive that you're going to have out-of-pocket medical expenses the following year, whether that be you're delivering a child, you have, prescriptions, glasses, whatever, that there's going to be some healthcare related expense that you're planning to spend the money on, and then only put enough to cover those expenses. Don't put more than that because again, you can't carry it forward the next year. It just goes away and you lose the money. So you got to be really careful with those flex spending accounts. They're great, but again, it's a use it or lose it plan. So you got to make sure you're going to use it in the year that you're contributing to it.
Yep, definitely. And I've had that be an issue with folks before. And it's just, if you lose that money, it just gets reabsorbed by the plan. It doesn't benefit you in any way, which is terrible. We hate you losing money, obviously. So all of this information, which is kind of a lot, gets us to the point where we're trying to make choices about what's the best plan. And I think, we have a couple of examples here, but if you're fairly healthy, like Corey was saying, and you don't have a lot of prescriptions or frequent office visits, a high deductible plan could be a great fit. It could save you money on health insurance premiums. It allows you to save into a health savings account. And if there is something catastrophic that happens, you have to be prepared to pay the deductible and maybe even to pay that out of pocket maximum, which can be higher than other plans. So we have to be really pretty well set up for emergencies if we're choosing to use a plan like this. In some way, shape, or form, either we have emergency reserves, we're okay with asking for some support from people in our lives, like whatever it is, we got to make sure that you can pay those out of pocket costs. Sometimes, even if you do have some ongoing medical conditions, an HSA can still make sense if they're fairly, moderate in scope, like they're not super costly. I think our situation is a good example. Like, we're young, healthy family. Our daughter does have some allergies. And so she has like an EpiPen and she has to see the allergist, and like none of that is covered. But like the out of pocket expenses that we incur because of that is still less than the savings on the premiums. And so, and we can pay for it pre-tax. We can pay for all of that pre-tax from our HSA. It's not too much to make it so that the high deductible plan isn't worthwhile for us. It's still worthwhile for us. But if you do have like larger prescriptions, more frequent prescriptions, more expensive ones, if you, see a doctor frequently, if you're going to counseling, if you're going to counseling twice a week and it's totally not covered at all through your high deductible plan until you hit your deductible, like that's a lot of money out of pocket potentially. So there's lots of places and times where it will make sense to choose that lower deductible plan and just pay a little bit more for your coverage.
Yeah, you just kind of have to do the math and look at what are my expected medical expenses. Obviously, there's things that are unexpected, which is why we have the insurance. You get in an accident skiing, you break your leg, you got to be rushed to the hospital, have surgery. That's what the insurance is for. If you sprain your ankle and need to get some athletic tape from the pharmacy to tape it up, you can afford that out of pocket. That's not what we have health insurance for. It's the big stuff that we're planning to cover. But yeah, if we know here's what our ongoing medical expenses are. We have an allergy, we need certain things for said allergy, inhaler, EpiPen, whatever. We know it's going to cost us this much every year, roughly. Okay. Does the insurance cover it? If so, if this plan covers it, that plan doesn't, what's the cost out of pocket for that stuff versus the premiums for the health insurance, and just, what's going to save you more money. Kind of like with the student loans, filing taxes separately versus jointly to factor only one spouse's income into the income driven payment for your student loans. All right. Is the payment savings greater than the tax savings? It's just, so you got to do a little, get out the calculator, do a little math, and then make your best educated guess on which plan to go with as a result. But yeah, research the providers you're going to see, the stuff you're going to need, and see if it's covered by that health plan, or if you have multiple plans, which one covers it or covers more of it, and just go with whatever the more favorable option is for you and your circumstances.
Yep. I think the other thing is that don't stress about it too much. Like, realistically, the most important thing is that you have health insurance. And if you're getting down to it and you're like, oh, I really don't know which one is better because like the math is just too close and things like that, whichever one you pick, it's going to be okay. Like, that's the bottom line. You have health insurance. That's the most important thing. If something big happens, you're only on the hook for a limited dollar amount. And some plans will probably be a little bit better or worse for you, depending on your and your family's medical history and other things that are just totally outside of your control. So just focus on the things that you can control. Try to make the best choice possible, but don't sweat it too much. Bottom line.
Yeah, fortunately for all of you in the healthcare world, like usually you have decent health insurance through your employers. So yeah, for the most part, you're going to be pretty well situated, regardless of which plan you have. It's just, some might have a little bit larger out-of-pocket expense than others.
Yep. And if you're self-employed, don't skip it. This is not a thing we skip. This is a
No.
thing you get.
Yeah, I don't know of anyone who forgoes health insurance. I mean, I'm sure there's some
Yeah.
people out there that don't have it, but yeah, I think all of you are we don't need to convince you on the importance of it.
You're doctors. Yeah.
So so yeah, having it as the main one, and then having the most appropriate plan for you, which is very confusing to filter through. Is kind of the next step. But
Absolutely. All right. As always, let us know if you have questions.
see you next time.